Dr. Kevin Schoepel is here today from the Gundersen Vascular Institute to talk to us about what's called peripheral arterial disease, also known as PAD. Give us an idea, first of all, kind of describe what is that disease?
Well, peripheral arterial disease, PAD, is kind of a new term in the last 10 or 20 years, but it's blocked arteries in your legs. Pretty common as we get older.
You know, a lot of people may have wondered, has this always been around, or did it seem to be more of something that's happening now?
It's always been there. It's something that we're recognizing more and more. I think it's vastly underdiagnosed and vastly undertreated, especially in the rural areas. That's kind of why I'm out trying to promote people to get the recognition so people can get the proper treatment.
What seems to be the cause of it?
Well, I tell people there's 4 things: smoking, 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 and some other things. The other things,
mostly smoking.
Smoking's a big portion of what we see, but as you get older, genetics plays a portion, and certainly high cholesterol, inactivity or lack of exercise, those kind of things that we kind of promote for overall health and well-being.
Well, what symptoms might people notice that they even mention it to their doctor?
Yeah, a couple of symptoms. First is just pain in your legs, usually when you walk. So you walk a certain distance, your calf or your thigh muscles start to hurt, ache, you rest, it gets better, you walk again, and so it's very reproducible. As the blockages get worse, they go on to sores or ulcers that don't heal. So anybody with a sore ulcer, anybody with pain in their legs when they walk could be suffering from peripheral arterial disease.
So is there a whole lot you can do about it?
Yeah, I think the first thing we do is medical management. So decrease your risks. Quit smoking, certainly on the forefront, treat your cholesterol, but then there are some surgical procedures that we do to help correct blocked arteries. In the last 10 to 15 years, balloons and stents, kind of like they do for the heart, have taken over. We have roto-rooters and all sorts of fancy stuff that we can clean arteries out and reestablish blood flow to the legs. Bypass, kind of like the heart, where we work ourselves around the artery, but we've got several treatments. Again, the first thing is risk reduction. The people with blocked arteries in their legs also probably have blocked arteries in their heart or their brain, strokes and heart disease. So that's one of our big messages. It's not just your leg, but also your overall health. So.
All right, good to know. Also, we wanted to point out that this is PAD month, just so we're trying to make you aware of it. And keep in mind that Gundersen, if you want to go to their website, they are offering free screenings for this all month. So if you'd like to, just head to their website and give them a call and try to set up an appointment. Thanks so much for joining us today, too.
I appreciate it. Thanks for having me.
All right.